Hi, Dr. Scott Jensen here. Today I want to talk about something that's very critical to all patients, and virtually we're all patients at some time or another in our lives. We might seek different kinds of healers. We might look for cares from physicians or nurse practitioners or physician associates or chiropractors or naturopaths or homeopaths or nurses, all types of, if you will, healers, physical therapists, occupational therapists today, whose doctor seem to have no care at all for the fact that this person is someone who has been in and out of assistance programs in the state of Minnesota because of true, genuine financial need. And she's just been able to get sort of on her own feet, and all of a sudden she's put on a medicine that will cost her $800 a month, and she doesn't have that kind of money. She has been sliced and diced by something called evidence-based medicine, EBM. What is evidence-based medicine? It's something you need to know about. Basically, my view of it is we sort of plug a patient into an algorithm. We don't take the whole patient, we just take a part of the patient. Maybe we take the patient's glandular system, and maybe they've got problems with their glands. So we put them over here with an endocrinologist. Maybe it's the pancreas. Or perhaps we take someone who's got a problem with cholesterol, but everything else is good. And we plug them into this. And this, and this is what has to happen next. And we never bother to ask them if they have sore muscles after they're put on the medicine. The bottom line is evidence-based medicine is the tool that physicians use to both direct the patient where they want him to go, simplify healthcare so that we don't have to have the hard conversations with patients and actually explain why we're doing what we're doing and why we think it's a good idea. No, we use evidence-based medicine. It frequently allows us to move forward relatively quickly, skipping the conversations, skipping the communication, and skipping the informed consent. This is what's happening. Evidence-based medicine sounds wonderful. Who wouldn't want to be cared for based on evidence? Well, let's talk about that briefly. If you look at the Curious, C-U-R-U-S, article, February 2023, by Dr. Ratani, Fatima, Abid, Sarani, and Sarani. The editor was Alexander Musovic and John Adler. The title of the article was Evidence-Based Medicine, History, Review, Criticisms, and Pitfalls. This is about evidence-based medicine. Let me just say this. It says, evidence-based approach is a one-size-fits-all approach that does not consider the differences between each patient. Each human is different. Goes on to say, how viable and applicable is the practice of evidence-based medicine for each person at the personal level? And then they quote Alvin Feinstein, an early pioneer in clinical epidemiology, who criticized evidence-based medicine from more than 2 decades ago, using the following words. And this is important. Alvin Feinstein, more than 2 decades ago, said, the laudable goal, the praiseworthy goal, the laudable goal of making clinical decisions based on evidence can be impaired by the restricted quality and scope of what is collected as best available evidence. It should be no surprise to you that evidence-based medicine is the tool frequently used by big pharma to advocate for their products and frequently to rule out other approaches. You typically won't see big pharma coming out and saying that there's value to vitamin D or value to perhaps vitamin B12 because those aren't the big dollar ticket items that they would want. Dr. Vinay Prasad recently put out in his Sensible Medicine Substack an article saying evidence-based medicine, 6 months a year. He basically describes evidence-based medicine as a potential tool of abuse. Doctors, bureaucrats, politicians use it. Dr. Vinay Prasad talks about the University of California, San Francisco Health Organization came out with a letter telling the community that they now are allowing masks to go by the wayside 4 years after it was started. As of May 1st, UCSF Hospital and West Bay campuses, face masks are no longer routinely required. But then it goes on to say this. Face masks are required in areas where direct patient care is delivered during the annual respiratory viral season from November 1st to April 30th. So while right now in May you don't have to wear them, come November 1st, you have to. On Halloween, October 31st, you don't have to. Evidently, something happens at midnight on Halloween that thereafter you wear a mask. What was the penalty recently if you violated the mask policy in San Francisco? Well, this is what Dr. Vinay Prasad said. He says, finally, until recently, failing to comply was considered a misdemeanor criminal offense in San Francisco comparable to minor assault or soliciting a prostitute. And he prints this date of order from California Health and Safety Code. And it says, violation of or failure to comply with this order is a misdemeanor, punishable by fine, imprisonment, or both. Now, what's interesting is that this date of order was February 28th, 2023. Frankly, there were many organizations that pushed aside the masks in 2023, even in the first part of 2023. And yet that was where they started this order, where all of a sudden it was being equated with a misdemeanor criminal offense comparable to a minor assault or soliciting a prostitute. Dr. Vinay Prasad says, academic medical centers are not generating evidence. They are not running a cluster randomized trial as they ought to be. This is oftentimes justified because of evidence-based medicine. Dr. Prasad goes on to say, it is important to consider that these policies are inherently tied to partisan politics. What he's saying here is that evidence-based medicine frequently emanates or boils up from the political arena. So it isn't just doctors or researchers. You're literally seeing politicians grabbing onto what they want to grab onto in the realm of evidence-based medicine so they can put these policies in place. This is lunacy. This is how patients get dissected into little components. Nobody's going to look at the whole big patient and say, gee whiz, you have asthma and hay fever and you wearing a mask might really be difficult for you. This isn't happening. Evidence-based medicine is an algorithm that you get plugged into whether you fit perfectly or not. The British Medical Journal said this about evidence-based medicine. Evidence-based medicine is the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individualized patients. That's important. They reference current best evidence. In other words, if we say today that you should not eat eggs, that you should wear masks all the time, and that you should not take an aspirin unless there's a specific reason for it. We're saying three things. Don't eat eggs, don't use aspirin unless you have a specific reason, and wear a mask. That might all be justifiable based on evidence-based medicine today. But if 3 months from now, evidence-based medicine says, whoops, that's no longer the conscientious, explicit, and judicious use of current best evidence. And they might change, and they might say, hey, eat eggs, take some aspirin, and you don't need to wear masks. That's how fluid our recommendations can be. And best medicine or evidence-based medicine is the tool that we use over and over again. Patients get so frustrated because they feel like they're being compartmentalized, dissected into small bits and pieces, and nobody's pulling them together. Patients are feeling like Humpty Dumpty, falling off the wall, breaking into a bunch of pieces, and there's nobody there to put them back together. There are people there that will treat this piece and this piece and this piece. Evidence-based medicine is problematic on multiple levels. I would ask, why aren't we telling patients when we put them on a medicine or recommend a surgery? Why don't we tell them, listen, the number needed to treat, the NNT, for this drug is 100. And let the patient know that if we treat 100 patients with this protocol, one patient will get the benefit, the desired benefit that we're looking for. 99 won't, one will. To me, an NNT is far more powerful for a patient to understand what they want to do going forward versus a doctor saying, wow, evidence-based medicine says that we should do this. Frankly, evidence-based medicine is a tool frequently used by doctors to bully patients into doing what they want. And one of the biggest users of evidence-based medicine is Big Pharma. That should be no surprise. You might think, gee, Dr. Jensen, you seem pretty jazzed up about this. Well, I've had it about up to my eyeballs. I mean, frankly, who the hell determines what the best evidence is? The limited scope and the fact that evidence-based medicine is generally built on populations of people should be a warning signal to you, because you are not a population. You are a single human being. And evidence-based medicine frequently oversimplifies, plugs you into an algorithm, and doesn't treat you and your unique situation. That's why I think millions and millions of Americans are increasingly frustrated with the health care they receive. Nobody told them in advance that the tool of evidence-based medicine is sharper than the sharpest scalpel when it comes to effectively cutting people into pieces so that nobody's really taking care of the whole human. You want to know why we got a crisis with mental health? You want to know why patients don't trust conventional Western medicine like they used to? Evidence-based medicine is part of the problem. And at the end of the day, it's one of the easiest ways for physicians to make a casual reference to evidence-based medicine so that they don't have to do the hard work of making sure that you have the opportunity to provide informed consent. Think about it.